And we're live.
Okay.
So, hi everyone. Welcome to Talking Live with Mei Sze. I believe that we are going to go through the same drill, although I haven't seen you guys in 2 weeks. We're going to wait for 15 people before we officially begin. I hope that those of you who wanted to tune in, you have made time to do so. I know today is a very quiet Sunday, and we are still technically in the main areas in Malaysia. We are still undergoing MCO. So we'll wait for about maybe a few more people to join in. Let's aim for 15 before we begin. And I want more people to join the stream because this is something that we should talk about. And it's very important that we understand more about it, especially because it does not just plague senior people, it plagues everyone from children all the way to adults. So please get people to join in to share more about this, about lymphoma, leukemia. And if you have questions, this is the perfect time to join us. Looks like we have 15 people already. So welcome to Talking Live with Mei Sze, everyone. I haven't seen you guys in 2 weeks, and I'm so excited to be back to share with you such an important topic today. For me, I've been it's the Chinese New Year break for the past 2 weeks. I'm sure most of you celebrating Happy Chinese New Year. I hope you guys had a good celebration, although it's a new normal in terms of celebration. But the most important is that we are safe and we get to celebrate virtually. So I even did an Lo Sang. So in Malaysia, there are certain parts still undergoing movement control order. I know some of you are from other countries like Singapore, UK, but I'm sure all of you were celebrating safely as well. So talking about today's topic, the reason why I chose it is also in conjunction with World Cancer Day. And in terms of blood cancers, we've probably heard about it, but most of us don't know about it, even myself, till I met some of my really, really good friends in my Young Cancer Survivors group. And that's how I found out that, for example, lymphoma is a blood cancer. So I want to just go through today's topic a little bit more. So most blood cancers, also called hematologic cancers, start in the bone marrow, which is where basically blood is produced. Blood cancers occurs when abnormal cells start growing out of control, like any cancer cells, interrupting the function of normal blood cells, which helps us fight infection and produce new blood cells. There are three types of blood cancers: leukemia, lymphoma, and myeloma. And within lymphoma, there's non-Hodgkin's and Hodgkin's lymphoma. So I have a few friends who have non-Hodgkin's lymphoma. So I guess our expert here today will talk more about that in just a bit. And more importantly, it affects both children and adults. So let's jump straight to the introduction of our expert. He is a hematologist from Prince Court Medical Center. So thank you, Prince Court Medical Center, for bringing such an expert on today's topic, and which is apt for today's topic, a hematologist. We have Dr. Dr.Zanapiah Zakaria from Prince Court Medical Center here with us today to answer all of my questions, and I believe a lot of yours as well. So if you have questions, please start asking them now. And remember, guys, this is a very important topic. Share this with your friends and family. Get them to join in, ask questions, be informed, and be educated. You don't want to scramble, knock on wood, if something happens. So remember to start sharing this, get them to join, especially those of you who have had relatives or friends or family who have had leukemia or lymphoma. So once again, we have Dr. Zanapiah from Prince Court Medical Center. Hi, doctor.
Hi, Mei Sze.
Thank you so much for joining today's stream. I'm really,
Thank you for
really
having
happy
me.
to have you. Okay, so Dr. Zanapiah, I'm going to jump straight into the questions. For
Sure.
those of you tuning in, you may start asking questions now. So many of us know about organ cancers, like what you mentioned earlier: breast, colorectal, ovarian. These are organ cancers, but not much on blood cancers. So could you tell us more about the various types of blood-related cancers that are out there?
So, in terms of, we are a bit different compared to the oncologists. Oncologists treat solid organ cancer. We treat what we call liquid cancer, which is blood cancer. And blood cancer, the three main form of blood cancer is leukemia, lymphoma, and myeloma. Uh, Among these three, the most common among these three is lymphoma, and then followed by leukemia, and then lastly myeloma. There's few others, quite a lot of others rare blood cancer, but these three are the three giants of blood cancer. And what else? In terms of lymphoma, there's two main types. There's Hodgkin lymphoma and non-Hodgkin lymphoma. It's all depend on which type of cells that been affected. And among the leukemia, we divide into two types. There's a chronic leukemias, which usually progress very slowly, months to years, and compared to acute leukemia, which can progress very rapidly within weeks. And then they are very ill patient, depends on what type of cells that they've been having, because acute leukemia have another divided into two broad group, which is acute myeloid leukemia and then acute lymphoblastic leukemia. So it all depends on which cells that been affected in this cancer.
Okay. So, talking about lymphoma earlier, you mentioned about Hodgkin's and non-Hodgkin's. I think most of us heard the term lymphoma, but could
Yeah.
you share with us what is lymphoma in layman terms?
In layman terms. So in our body, we have this what we call lymphatic system. So lymphatic system, which sort of like our drainage sewer system. It drain all the junk from the tissue and then filter it and then back to our circulation at our vein here. So it's a one-way system, a sewage system. And lymphoma is a cancer of this lymphatic system. So it mainly affected the lymph node, which is the filtering organ of this lymphatic vessel. So all the junk, the toxin, when drained, and then the lymph nodes filter it, and then eat all the toxin, the bacteria, and then go back to the circulation. So what's wrong with lymphoma is the cell in the lymph nodes get mutation and then start growing without any control and then become um, increase in size and cause a lot of symptoms. So symptoms, it can be swelling. If you can see that our body have lymph nodes everywhere, from we think about 200, 300 lymph nodes everybody. But the main is around the neck, the axilla, the groin, the one that you can feel. But inside in the chest and abdomen, those are the main organ sites of the lymph nodes. So the swelling of the lymph nodes, and then the symptom, what we call B symptoms, so which is weight loss, night sweats, fever. Those are we call a B symptoms. So those are the main symptoms of lymphoma that we want to try to educate our patient
I see.
and the public
Um,
as
I,
well.
I I heard about the swelling in the lymph nodes around the neck. So that's
Mm,
how many actually find out about it. So that's
mm,
a good thing. So if you guys
mm,
find any abnormal swelling around the neck, as Dr. Zanapiah mentioned, the groin, or I think near the armpits, this is
mm.
something that you should take note of. And my next question is, how is it different from leukemia?
So it's the leukemia is the cell in the bone marrow that has been involved. So it depends on which cells that involved, whether it's myeloid cells or the lymphoid cells. So that's all been produced in the bone marrow. So leukemia is usually originate in the bone marrow and it's all been uncontrolled growth and then cause a lot of problem in terms of the function of the other cells. If you affected the red cells, you can anemia. It affected the white cells, become recurrent infection. If it affected the production of the platelets, the three main type of blood cell, the what you call the red cell, the white cells, and the platelets. So all this can be affected by the growth of this abnormal leukemic cell in the bone marrow. Compared to lymphoma, is mainly the lymph nodes, where is all the problems start.
I see. So the difference is that leukemia is within the bone marrow and lymphoma is within the lymphatic
Yeah, there's
system.
a exception. Some a very uncommon one. It can go, but
All
most commonly, is leukemia is in the bone marrow. Lymphoma is in the lymph nodes. But there is exception because the
okay.
lymphoma can go to the bone marrow as well. They what you call they are metastasized to the bone marrow. Yeah,
I see.
yeah.
So, guys, remember, I start asking questions now. I don't want a backlog at the end. My next question is: in Malaysia itself, do you see many lymphoma patients?
So, in terms of the Malaysia Cancer Registry, that been the latest one, the 2012 to 2016. So, lymphoma is among the fourth of the most common cancer in Malaysia. So, we can see out of that fourth, it's about constitute about 5% of the total cancer. So, it's not that common, but it's still there. So, we
Mhm.
see around about a thousand, what I call a thousand a year of patient
Okay,
being diagnosed with lymphoma. Yeah,
I see. So there are a
yeah,
few of those patients in my young cancer survivors group. They're
yeah.
amazing. They're so inspirational,
Mm,
because some of them, when they are stage four, like I mentioned, it recurs.
mm,
So
mm,
they battle it and they're still battling it.
yeah.
So my next question is: how's the survival rate like if a person gets lymphoma?
Oh, and it depends on a lot of factor in terms of survival rate. Also, we see what we call the prognosis factor, with a lot of what's prognostic scale that we do, and then we can give a score, and then we try to give the survival rate. So the earliest stage of lymphoma have a better survival. That's why we try to educate the public, present to the doctors early. So on stage one and stage two have better chance of survival. They can go up to about 60% to 70% cure rate, long-term cure rate, compared to when you have presented to the doctor at stage three and stage four, and the survival go down. Or it depends on a lot of factors as well, but generally in terms of stage three and stage four, the survival about half of the early stage, around about 30 to 40%, because they tend to relapse. So
Mm,
that's why, and sadly, in that cancer registry, found that about 60% of Malaysians presented at the later stage, both Hodgkin and non-Hodgkin lymphoma. 60% of them are stage three and stage four, which make the diagnosis, make the prognosis is a bit worse compared to the early stage.
I see. I think that goes for most of the cancers when they present at stage three and four. Prognosis reduces and survival rate as well. So,
Yeah.
what about the survival rate of leukemia patients in Malaysia?
So in leukemia also it's a bit different, because we don't stage leukemia,
Okay.
because leukemia
Interesting.
it's cancer of the blood, which travels the whole of body. So practically when you've been diagnosed as leukemia, you are stage four, because the cancer
Wow.
is which. So we don't stage that, but we do a lot of other things in terms of the prognosis. So still same, age, sex, how aggressive is the lymphoma, the leukemia, how high is the total white, the genetic study, the molecular studies, all of that has been taking account in terms on, and then we give the roughly survival in terms of the response of the treatment as well. So acute myeloid leukemia in general, with treatment which involve chemotherapy plus or minus stem cell transplant, it can go up to 70%. So it's quite general in terms of the prognosis compared to acute lymphoblastic leukemia. Their prognosis is a bit worse. It can go up probably about 50% with treatment, with chemotherapy plus or minus bone marrow transplant.
I see. Wow. So leukemia, there's no staging, and once you get leukemia, you are staged technically at stage 4 already.
Yes, yes, because it's
Very interesting.
the blood circulates everywhere. So the
Oh, very,
in the
yeah,
yeah. So
that's
because
true.
the way that we stage is how much spread in our body. So we cannot. That's why we cannot stage leukemia.
Okay. And could you share about with us about a bone marrow transplant?
So
What is it?
it is part of the treatment of leukemia and lymphoma and myeloma. So, and in terms of bone marrow transplant, there's two uh, type of transplant, which what we call autologous transplant. Uh, Autologous, which means that we take your own stem cell, uh, and then freeze it, preserve it in our what we call stem cell bank, and then we give high dose chemotherapy to the patient, and then we reinfuse the stem cell that been collected earlier. That what we call autologous stem cell transplant. That one a mode of treatment for patient with mainly lymphoma that relapsed after the first line of treatment, as well as the first line for consolidation for myeloma. So that one we call autologous transplant, which is your own stem cell. Then the second type of bone marrow transplant, what we call is allogenic transplant, which is we take the stem cell from somebody else. All right. So the somebody else, we need a donor. So the donor might be your sibling. Among your sibling, we have to what we call type to look for a suitable donor, we call HLA typing, see whether there's any one that match with your the patient self. Or if you don't have match, then we go to a what you call stem cell registry from unrelated donor. We look Malaysia will have a stem cell registry. I think it's about 36, I think, thousand of Malaysian been volunteered and registered in the Malaysia stem cell registry. And if you don't have that available donor from that Malaysian standard, we go to the international stem cell registry. Usually we use the Singapore, which is based in Singapore. We call BMDP, bone marrow donor program in Singapore, which search the whole world to find a suitable stem cell donor, either in depends on the ethnicity, because stem cell transplant need to have a suitable. So if it's Chinese patient, sometimes we search for in Singapore registry, Hong Kong registry, China registry, those Taiwan registry. Uh, if it's Malay, unfortunately, very limited. But sometimes we can find in Singapore registry as well. So then what we do, we collect the stem cell from the donor, same thing, and either we give it fresh, which means that we give chemotherapy, high dose chemotherapy to the patient, condition the patient, and then infuse the stem cell that we collected earlier or fresh to the patient. So that's the transplant we call allogenic stem cell transplant. So
I see.
the stem cell is going to be a different one compared to the autologous.
I see.
Is it
Okay.
okay?
Wow.
Is it
Yeah, yeah.
too
That
complicated?
is, no,
It's
no, no.
okay.
That is actually very, very informative, and it's
Uh,
good that we have quite a lot of volunteers that donated their stem cells in Malaysia, and also that we are also working with Singapore on this. We
yeah.
actually, I know that some of you from Singapore are watching this, so you can ask questions as well. Don't worry, although we're in Malaysia, but then you can ask questions, anything related to lymphoma, leukemia, or related to any Singapore stem cell donors transplant. I'm sure Dr. Zanapiah will try to answer them. And for those of you, it's time for you to ask more questions, because I have one last question for Dr. Zanapiah. I would like to ask, what are available treatment options for blood cancers?
So in general, in terms of the first line is chemotherapy, yeah, and then we nowadays we have a targeted immunotherapy as well, and then the latest one, or the after that, transplant, stem cell transplant, And later on, we have what we call engineered CAR T cells. Those are the difficult patient who have very very resistant disease that we can't use the conventional treatment. That we need to go all this treatment for them. The one that very intensive treatment.
I see. Okay, so
Mm.
chemotherapy is still the first line treatment
It is
for.
just yeah,
I see. Okay.
yeah.
So those are my questions. We're now going to take
Mm.
on questions from all of you.
Mm.
Remember, I know many of you have questions. Yeah, if you're shy to ask, you can DM me. But this is the best time because Dr. Zanapiah is here. And remember, share this live session with your friends, family, so they are informed and educated about it. That they understand if there's an abnormal growth on their lymph nodes, which is around the neck, the armpit, or their groin, they are aware of it. So this is for lymphoma. Leukemia, I think, is a bit more difficult to detect. So I will just jump straight to the questions from you guys. So Sansan asked, what type of tests to be done to detect blood cancers?
So, screening in terms of we see few patients that been detected by a medical screening, either the medical health screening or insurance screening. So, blood cancer. So you have to do a blood test. So, and from the blood test, we look for especially for what we call full blood count to look for the hemoglobin, the white blood cells, and the platelets. From there, sometimes we need to proceed what we call a peripheral blood film. We look under the microscope and to see is there any abnormal cells or not. That's how we detect leukemia. Lymphoma, usually patient present with node swelling. Either incidental finding when we do a chest X-ray, a shadow that's not supposed to be there, and then we further investigate. Or patient present with the one that I said that all the symptoms of night sweat, loss of weight, loss of appetite. Those are the things that we patient will turn up to on our doorstep.
Okay. So that is a type of
Mm.
test to detect blood cancers. So
Mm.
in the next question is Beverly Sia asked, she had
Mm.
three questions in total. What is
Okay.
the cause of lymphoma? That's the first. The second is
Mm.
what is the maintenance after the full treatment? And the third is what is the recurrence rate? So the first question is what is the cause of lymphoma?
So, in terms of etiology or the cause of lymphoma, it's really unknown why the patient developed this lymphoma, whether there's any, what you call, most likely it's a multifactorial, whether this environment, the food that we take, any
Okay.
chemical exposure, but it's not in what you call inherited. It's not infectious that we know of. But in terms of some patients have a lymphoma because of they have treated by that we know of.
Sorry, can you hear
Oh, sorry.
that? I want to check
Yeah.
the comments.
Some patients have
Oh, okay.
uh,
Yeah, sorry, go ahead.
what happened there?
I
So
wanted to check the comments.
okay. So the cause is a bit difficult to determine in terms of why the patient develop lymphoma. But those are some patient or you get some have other cancer before, been treated with some chemotherapy, and they develop secondary cancer or lymphoma. So it's called secondary cancer. So because of the previous chemo exposure. But it's very uncommon. More so the second question, what's the second question?
What's the maintenance after the treatment is complete, after the full
Okay.
treatment?
It depends on the type of the lymphoma. Certain lymphoma, we find that study has found that there's some benefit in giving maintenance chemotherapy or immunotherapy. And each disease or each lymphoma has its own regime in terms of some just oral tablet,
Mm,
some is injection. So it's quite varied in terms of the maintenance. And relapse rate also depends on the type of lymphoma. Some lymphoma are very prone to relapse. Depends on whether they are what stage are they are presented to, or some cells are known to have very aggressive. So that sometimes we anticipate that this patient will relapse. So if after the first line of chemo, so we go what we call upfront treatment. Sometimes what we give a autologous stem cell transplant is one of them. Before they relapse, we transplant them.
Okay.
Mm.
Thanks a lot, Dr. Zanapiah, for answering Babley's questions. Babley, we hope that we've answered your question. Sansan had another question. So, guys, remember, if you have questions, this is the best time to ask. Dr. Zanapiah is a hematologist with Prince Court Medical Center. So, ask away about leukemia, lymphoma, or myeloma, and he will be happy to answer them. So, the next question is from Sansan once again. Why is leukemia? Why does it mostly affect children and teenagers? Leukemia, she mentioned, and is it hereditary because she lost her nephew to leukemia, but both of her nephew's parents are not carriers.
Oh, okay. So that there is a leukemia that you can inherit, but it's very, very, very rare in terms of the inherited leukemias, because they usually have some genetic predisposed. For example, patient with Down syndrome, they have a higher risk to develop leukemia. Yeah, but in terms of frequency, leukemia have a bimodal graph. There's one that have presented during the childhood, and then later on during the adulthood at around 40 to 60 years old. So they have a bi wave in terms of frequency. But the children have a different frequency in compared to the adult. The most common leukemia in children is acute lymphoblastic leukemia, compared to the adults one. Adults, the most common is acute myeloid leukemia. So it's a bit different. The good thing with the children leukemia, they are more responsive to the treatment. Okay, so the treatment, that if they respond, they usually have a very good prognosis. Depends on case to case, but generally, their response is better compared to the result are better compared to the adults one. Our
Okay,
pediatric oncologist or hematologist very, very proud their result because their survival rate is higher than the adult one.
that is good news though,
Yeah, that's good news.
because they're children.
Yeah.
So, Sansan also had one more question. With bone marrow transplants for leukemia, what's the chance of survival? Is that the best form of treatment?
Yes, yeah. We know that some the treatment for leukemia sometimes the chemotherapy is just not enough. What we do manage to bring them as the lowest number of leukemic cell as possible, and then if we follow up at a certain period of time, it start to come up again. So by just giving chemotherapy, so we try very hard in terms of finding a donor for patient with leukemia. This is what we call acute leukemia, and then I said it's varied in terms of patient to patient, but in certain patient we do a analysis that they will have a better chance of survival if they undergo a stem cell transplant, because in that situation we manage to get rid of all the leukemic cell as much as possible.
Okay. Um, the next question is from Teresa. She
Mhm.
asks, is there any scientific studies that these liquid cancers are driven by glucose or protein or fat driven or hormonal?
No. There's a lot of hypotheses, but to prove that is going to be really difficult in terms of the causative. We can see that some link, but in terms of really to find out this is the cause of leukemia is very difficult.
So currently there are, similar to quite a lot of cancers in general, blood cancers, there are no causes. Like we can't determine one main cause for the cancer, right?
Yes.
Okay, so
Yep.
that wraps up our questions from the audience. Do you have any more questions, everyone? If not, we will wrap up this session with Dr. Zanapiah. He was very informative. He answered all of our questions, although it's such a difficult cancer to explain. Within all we know is that it's related to our blood system and it's liquid in that sense. So thank you so much, Dr. Zanapiah, for answering all of our questions. We have one last question from
Okay.
Madam Gimbi Yo. She asked, roughly what would be the cost of stem cell treatment, stem cell transplant, I believe.
The cost, the money involved, is it?
Yeah.
Yeah. So it depends where you going to do the transplant. So in terms of in Malaysia, there's a government setting, government hospital in terms of doing transplant. The main center is Hospital Ampang. And then that's very hugely subsidized. So the patient, if it's from the sibling, so or the half sibling match, the cost is quite very minimal. I'm not sure the exact cost, but usually less than 1,000 probably. Yeah, compared to in the second center or the university, the University Malaya, UMMC, and UKM, HUKM, where I'm doing my transplant. So they are corporate, which means that they're partly subsidized by the government. So also varied in terms of the cost, but in average they have package. So if I'm not mistaken, it's around what 50 to 60,000 per transplant, and then go to the private setting. Private setting in terms of the center that doing the stem cell transplant is Subang Jaya Medical Center, as well as Sunway Medical Center. They cost a lot, so it can go up to 500,000, but on average about 200,000 per transplant.
Wow.
So yeah.
Okay, that's
uh,
good to know. So, for Malaysians, at least you know that Hospital Ampang would be a good choice because it is the main center and it's heavily subsidized by the government. And second options would be HUKM and uh,
UMMC.
UMMC, and the final
Yeah.
is of course private options, which is
Yeah.
SGMC and Sunway Medical. So,
Yeah.
thank you so much, Dr. Zanapiah, for all of
Okay.
your for actually graciously answering my questions and everyone else's question. I mean,
Okay.
for me, it was a very informative session. I'm sure for a lot of people who are tuning in right now. Thank you so much, Dr. Zanapiah from Prince Court Medical Center. So if you want to find him, he's a hematologist at Prince Court Medical Center. And for all of you, if you have further questions, you can DM me if you were shy to ask. I'll try to ask Dr. Zanapiah after this. So I will not be having a session next week, but I will be having a session after next week. So the second week of March. So stay tuned. I think it's something all of you want to find out. It's about nutrition and the gut. So I hope to see you guys then. And thank you once again, Dr. Zanapiah from Prince Court
Thank you,
Medical
Mei
Center.
Sze. Thank
Thank
you very
you.
much.
Have a good day and have a good
Yeah.
day, everyone. Stay safe.
Okay, bye.
Bye.